Hi, my name's Colin Sears. I'm the EMS Operations Officer for Las Vegas Fire and Rescue. About 7 years ago, we recognized that there's a subpopulation of patients that access the 911 system and the services of EMS and even the hospitals at the emergency departments for mental health complaints that don't really require that, or that those services aren't specialized in. For that reason, we spun up the Crisis Response Team, or CRT, which is an ambulance team with a paramedic and AEMT and a licensed clinical social worker, or LCSW, that responds to the calls we identify that are psychiatric in nature. Our 25 EMD cards are automatic dispatches for these units. By sending the LCSW to the scene, we are sending to the scene the clinical care that they would hopefully receive at the hospital. And by doing that earlier in the process, we can do two things successfully. We're getting the right resource to the right patient at the right time in pursuit of the right outcome, and we're creating approximately 75% to 80% success rate in hospital diversion. Hospital diversion is important because if the patient's not receiving the right resources when they arrive at the hospital, or they're delayed in some nature, then that's not in pursuit of the right outcome. Also, we know how valuable real estate is at the hospital for acute medical and trauma needs, whether it's a heart attack or a cardiac arrest or any of those things. So if we can divert those patients away from the hospital and get them directly to the right resources, then that's a successful program. This year, we're on pace to run about 4,500 calls, which is 4,500 911 calls that would have traditionally landed in the emergency department. And with our 80% success rate of diversion, we're getting all of those patients to either the right resource, which is sometimes stay where you are, sometimes it's a shelter, sometimes it's a behavioral health hospital, sometimes it's outpatient resources. The LCSW has the latitude and the clinical knowledge to direct these patients wherever is clinically appropriate, and that's one of the things that makes our team so successful. We recognize that Las Vegas has a few vices, and if you have indulgences, you're likely to take them here. So we think, and we share that with a lot of cities around the country, but we think by having this layer in the 911 system, it brings efficiency to those patients' outcomes, it brings efficiency to our healthcare partners at the hospitals, and it overall brings efficiency to the 911 system. And if everybody can benefit from that, we think that getting the right patient to the right services and keeping real estate available at the hospitals and units available on the streets for critical 911 calls is a win for everybody, and it's a program that Las Vegas Fire and Rescue is very proud of.